welcome to the Health and Human Service Committee meeting in person. um, we have a couple of things on our agenda. Um, we don't need to do no introductions because it's just us.
Up to you, Chair.
No, I mean, do you want to do
You can do it
introductions? All right.
directly.
Any introductions for you guys? No. All right. We're gonna go straight to the health symposium and the health fair. Do you guys have any questions before I even jump into the ideas and brainstorm of what we're gonna do for the next couple of months? So the health symposium is something that we are brainstorming, possibly for Wednesday, August 6th, 2025, here at Lincoln Hospital from 9 a.m. to 3 p.m. And
That's it.
yeah, that's what. Go ahead.
So thank you, Chair. So real quickly, as the Chair talked about,
Brainstorm.
is that this is it's a great opportunity. The full board chair suggested that all the committees strongly start thinking of projects or events and stuff that we're going to be doing that's going to be long term to help support the work that the committee board is doing to ensure that we are being intentional about our work and not just making decisions and giving presentations, but making sure that we are doing actual events that bring important information, resources, and conversations and convening people together in the community. So one of the suggestions were to do a health fair, and which is one event that working together with Lincoln Hospital brings the resources of all its departments to bear to the community. We know that COVID has, of course, made getting appointments for specialties and services enormously long. And so we want to make sure that we have a healthier community. Unfortunately, the South Bronx, our district, is last on the list for the most, and has been looked at the most unhealthiest community for person, would you say, but almost as long as you can remember, right? For the South Bronx. So a long period of time, but she'll answer that.
Excuse me, I
Right.
was distracted.
So that has unhealthy. How long have you the South Bronx been known?
Not 62.
62
For years.
For years, so at least 2 decades.
Yeah.
And so that means that we are number one for so many social and physical mental health issues: diabetes, heart disease, cancer, and we are number one. Where traditionally these diseases people are evaluated at a later stage of their life in their 40s and maybe some 50s, that we're finding that a lot of people are having, unfortunately, have had episodes or have issues with this disease in their 30s and 20s. So we have a particularly very obesity, diabetes, heart disease, cancers, respiratory and other illnesses. Yeah. So the health symposium is the idea that will be able to bring together practitioners or professionals in various different health areas into a community to have conversations about a couple of things: health disparities, best practices of how different hospital facilities be able to, and medical facilities help combat these issues, and to start bringing conversations together about how we can improve and build on what we've learned, especially since what happened after COVID.
Yeah.
Long-term COVID has enormous amount of effects. Some of us have lost people. Some people have issues with that.
Misdiagnosed. It's a long list of
stuff. And so, the chair and all of you are interested in talking about and doing is start having that conversation about what our health symposium would be. So we have a great idea about bringing professionals from some of our health institutions that are in our borough that some of us go to. And we likely host it here at Lincoln. The new CEO of Lincoln wants to be able to host this great event. But the planning and what this event is doing, what the outcomes are going to do, it's going to lead to it. And this all includes all of us.
Yeah.
To have that type of conversation.
And so what that, thank you, Anthony. So what that looks like is like, imagine watching Tech Talk, right? And it's going to be a panel of just professionals and also just a bunch of individuals who really care and have, knowledge and health, right? Like Anthony was saying, what this is going to do is just open a discussion for a lot of barriers. And something that I took heart for was cancers. You know, people are at a now at a young age finding out that they are either having a cancer scare or even in the stage of getting chemo, etc. For me, mental health and well-being is something that I really am advocate for, because everyone is either dealing with something that is challenging that they don't know how to deal with, or just trying to face something that no one else or can express, right? So this is something that we're brainstorming, and we want to bring it to you guys so that if you guys have any ideas or comments, we can add to the document for the symposium that is going to be on August 6th for sure, right?
That's the idea.
That's the idea. It's from 9 a.m. to 3 p.m., right? And so, should I tell them exactly how it's going to be broken down?
What we have in mind so far, but it's open discussion for folks to be able to contribute to this conversation.
Yeah, so at this event, the discussion will be addressing healthcare topics that are essential for raising awareness and promoting overall health among all attendees. Public health and policy, I think that's very important. A lot of the time, you go to a hospital or a clinic, especially for a hospital when you're getting ready to get approved for a surgery. A lot of the times, the approval doesn't come as fast as it should. And then that patient is in the emergency room or in the bed, and they can't even get that surgery because it wasn't approved, right? It's a list of certain of those type of scenarios, which I'm so interested in to know what's that process like, and how can we be able to what can we do when it comes to those type of topics. Innovation in healthcare, mental health and well-being, community health and advocacy, chronic disease management, maternal and women's health. This is a big number one right now. There are a lot of females Black and brown who are facing this discrepancy when it comes to being treated fairly, especially not getting the proper care when you're at the very end, or even knowing whether or not you're at high risk. I remember when I was 6-7 months pregnant, I was high risk. I did not know what that was and what that looked like. And so I had to change my diet, but also not being informed of what that looks like. So respiratory illnesses, diabetes, heart disease, we have customer service, quality of service, patient experience. A lot of times, I know that's a big one.
That's a day within itself.
I know. But how can we be able to how can we tackle that? Because I know that's going to be big, right? And we spoke about that. Almost half of the stuff that we mentioned here is big. Mm-hmm. What would that look like in the panel? We don't want to attack the people who are going to discuss the topics, but we want to be educated, right? And we want to also inform the community on what services that they're offering and what they can do if they experience certain things. Shortages in staff and resources. I was sharing my experience when I was about to give birth. I was 5 days overdue. I go to the hospital. I'm not gonna say no name. I go in, and when I'm getting ready to be admitted, it was the whole lobby was being constructed. They had a whole tape from one end to the other end, and it was they were drilling, there were powder and everything. Like, what does that look like? What can we do when we see things like that? And I'm about to give birth.
Okay.
So those are the brainstorming that I'm having, like that we're discussing. Faculty management, public safety, disease control, environmental sanitation, and the open discussions to anything else that maybe you guys might think might be important to discuss. So I will open the floor if anyone has any comments and concerns in regards to the health symposium. Yeah.
This is such a wonderful idea. I have 3 suggestions for speakers on these topics. I'm not sure if that's what we're looking for right now, but for example, for New York City Health and Hospitals, and what are the resources, what is available in terms of arts and wellness. And arts and wellness covers all the social determinants of health. So whether it's dance, culinary, job skills. And New York City Health and Hospitals has an arts and medicine department, and it's run by Larissa Trinder. And she's for all 11 safety nets. She is the head of arts and wellness, and it would be wonderful to have her as a speaker. And I can follow up if it's easier, rather than me talking a lot now. I could just send these in an email.
No, wait, this is, we're just brainstorming, we could jot everything down, yeah.
So Larissa would be one from New York City Health and Hospitals, and the others are patient experience, and again, in terms of arts and wellness and creative healing, like community as medicine.
Mm-hmm.
Urban Health Plan has an incredible new program called Arts for Everybody that looks again at all the arts, whether and culinary, theater, dance, movement, everything that affects our well-being and connections to each other in terms of social isolation. And they're actually doing it within the clinics. So it's not only something of social prescribing where they will prescribe you to go to a play or a class or an art show. It's actually happening in their centers. So the head of that department, Andrea Sofia Matos, would be amazing. And for resources, one of the resources that supports Lincoln and New York City Health and Hospitals is the New York City Office of Mental Health.
Mm-hmm.
And they are opening in the Bronx as well, just like the other two centers, a wellness center that's opening this month, 17,000 square foot space that will be all about wellness in terms of, I don't like to say alternative, but other ways of looking at healing. So
Yeah.
And that's right by.
The heart space?
No, the heart space, that's that's another one, heart space, we need to get Arif here to
Yeah.
speak, but that hasn't opened yet. This is actually within the Bronx Psychiatric Center, which is the.
Water's place.
Yeah, exactly, Waters Place. And having Dr. Boudreau, the head clinician, or come and speak to that, or even Sherry, the executive director, these would be like, they're right in the Bronx.
Yeah.
These are super innovative programs. Like, having the Bronx be the first borough to have these is a huge deal. And the most deserving of it, right? And so these three speakers are, really Bronx centric. And I think they're all for a lot. And I'm happy, I know them, I work with them, they're my clients. I can definitely get a connection if that's.
Yeah, no, that's really good. Anything, we're jotting everything down because it's something that is not gonna take place until August, so we wanna ensure that I've been meeting with Anthony on a weekly basis, just so that we can have everything concrete, but as we go along every week, we're adding additional stuff, so yeah, I'm happy for that. Yes,
So
Sure.
I do want to make a suggestion about, so it sounds like a lot, right? Like it's a lot. And I do want to make a suggestion to kind of create a theme for the symposium, right? And I think like we think about like, what is the message, right? Like, what do we really want to get out to the community? And if we want to make this about like a wellness symposium, I'm visual. So I broke them up into like little boxes, right? I like the idea of like the arts and wellness, because that's one form. Then you have the mental health piece where you have like different mental health folks involved in that. Then you have the public health piece, right? And that encompasses like gun violence. I know this is a trauma response hospital, and so like really figuring out like what Lincoln is doing, what those numbers are. What's like, we know there's a GDLU, but like more in depth about like how is Lincoln combating like those issues. The other thing that goes under the public health is like the lack of access to healthy foods. So there's that piece, but then there's also the environmental justice piece, right? Like, while yes, we talk about like being diabetic and all the foods we could eat and the lack of exercise, but then like, what are the external impacts? What are the environmental impacts that are causing cancer? Are causing like, how does because technically, right, in the Bronx, like congestion pricing has some kind of issue. It affects us in the Bronx differently than how it affects folks in Manhattan. So like, what are those health issues? We know that Department of Health got $20 million as a payment, as a grant for the fact that congestion pricing was going to impact the Bronx. And so like really digging deep, but I would try to figure out what the theme is. Like, what are we, is it like, why is the Bronx still unhealthy? right? Like, why is the Bronx still unhealthy? I'm just thinking like what the theme is to kind of figure out then like how to break it down. Because if we're talking about that, like I don't see like patient care is great and we need that's another conversation, but maybe not for the wellness symposium, right? Maybe that's like a different space. But that I'm just suggesting that, trying to like figure out like.
So the reason why we added all this stuff is that's not gonna be the symposium because we know that that's gonna open the door for the health fair that we're gonna have the following week. So the symposium is gonna be on the 6th, and that's gonna invite us to actually collaborate and speak more on things that we probably were unable to touch for the symposium for the health fair, which is August 13th. This is gonna be a week after. And I agree with that too. We have to really figure out what is that theme? What is that like? What we're gonna talk about? What's the thing? Yeah, Jackie.
And for the mental health, right? It's the big issue that we have in this area is that we don't have much services for ABA, OPWD. I just found out about OPWD last year. My son was diagnosed for 7 years already.
You gotta tell me what OPWB is.
I'll tell you about that.
Break it down because
okay,
I
so
found out I learned about this last week because I thought of you and I said for the health fair we need to have more programs that caters to families who are struggling to help their child and understand and be diagnosed and
Maybe that's another piece.
So OPWD is a program and they help you. Well, like for instance, for like me with my son, I work, so I don't qualify for SSI. So, for instance, they'll help me get occupational therapy. Every therapy he needs, they'll help you get that for him. But they also help you pay for a babysitter. If you need after school, they provide for the after school program. If you need referrals for anything, they give that for you, and they also give you monthly money. Because, like, for instance, for my son, I have to buy specific clothes, specific sneakers. So they give you a budget that you could be able to afford. And it's like, but you have to make a certain amount, and your kids have to be because there's different levels to autism. So it's like you have to meet a certain criteria in order for you to be able to qualify. But this has been on for a long time, and I just found out about it. Especially ABA, they just opened an ABA clinic around here, part of one of Fat Joe's organization, and I just found this out through Instagram. And they've been around for like almost 5 years, and I'm like, again, it's something we're not aware.
We're not talking about it. We're not aware.
Well, we have an education.
So we know. OPWD is Office for People with Developmental Disabilities.
Yes.
And
they help you with everything.
You said ABA?
ABA is a therapy that they give to kids with autism.
Behavior analysis.
Yes. But a lot of those resources
also
don't
work
have
in
it.
that space too, right?
Yeah, my son is on the spectrum as well.
So you
know,
you know more.
And it's so you
I think that's a big topic too.
And there's a lot of things with that too. It's like us parents, like we have to do the research and we have to find
advocate for your
because literally is what it is. Your child's diagnosed. We can't help you anymore. Now you have to see a social worker in another place. Then you get there and they gotta see you. So it's a struggle and parents give up.
Yeah.
Like it's gotten to the point that sometimes I'm like, I'm gonna go on FMLA because I have to go to the district to get an iPad that's on his IEP that they legally supposed to have. He started school in August. I went to go pick this up in January because I was like, no. Either since no one's gonna bring it, I'm gonna go get it.
That's right.
So it's something that it's a big, especially in this area we in, it's a big.
It's like jumping the heat.
Yes.
The services that you need.
And then it's like we in a poor community that grandparents are raising kids.
Yep.
Some of these don't even speak English.
Yep.
So it's like
Barriers.
You know, I'm part of in my church. We get a lot of people in that it's like I have to translate. They don't even know how to even get their child to even get diagnosed. Like even how to get an IEP. Like it's big. It's a big struggle.
I'm wondering. So for this symposium, I'm wondering if it's and this is an idea that I was thinking about. Like if we could have this entire floor, like all the conference rooms.
So that was that's the goal.
Because what I'm envisioning is usually when and I don't know about anybody else, and this is just suggestions, nothing that I like. We don't have to like implement this, but when I go to like these conferences or when I go to like a symposium, I kind of love when they start off with like this huge motivational speaker who knows all about like health. And you know who's really good at that? Who's the CEO of Montefiore? What's his name?
Doctor is here.
He's an African
Dr.
doctor.
Philip Oza.
Oh, OZ.
Yeah.
OZ. He's an
Yeah.
amazing doctor, actually. His story is pretty fascinating.
Mhm.
So he's a really good speaker, and when he talks, I think it'll be good to have. I don't know how LinkedIn will feel. Like, I don't know how they can. Is
So-
that a thing?
So we
Well,
so-
Like, that's also, we got to be mindful of, like,
let me, can
the
I
hospitals.
break it down what we thought of and let me know. So 9, yeah, we are on 9 to 10 a.m. breakfast networking, 10 to 11:30 first panel discussion, CEO health leaders. Lincoln Hospital, we have Christina. Montefiore Hospital, we have Dr. Philip. Ozzy, Bronx Lebanon, Bronx Care Health. We have, that's me again?
Yeah.
Fuentes, Columbia Presbyterian, we have Stephen, Urban Health Plan, Paloma, Lenox Hill, Danny Baker, and then 11:45 to 1 p.m. is lunch. 1 to 2 is addressing the health disparities, and all the overall health topics, and then 2 to 3 is healthcare goals.
So I think one of the things we need to think about is the fact that we're inviting other hospitals into Lincoln. And so, I don't know, that might be, I don't know how that,
Just like based on my experience, is like a speaker.
competition.
A
Yeah.
speaker is okay, but like they can come with a resource, like provide information.
right, it would be. So I'm wondering if Lincoln Hospital is not the place.
So what the conversation was that not to that the hospitals won't be marketing, the
Right.
outside hospitals won't be marketing themselves,
Right.
but this is brought as part of the conversation of what their experiences leading and these and the issues that have impacted, because the conversation and the idea of the helpless, and correct me, Chair, if I'm wrong, is to understand best practices and to figure out how we can work as a network of hospitals, whether it's private or public, to be able to help resolve the healthcare needs. The unfortunate thing has been happening that everything's been happening in a silo. Recently, when I say things happening in a silo, some information is only available, and I guess it's only available in certain communities for kids with autism, and it's not available in other communities. And so it's really sharing where the resources are, and then
But
also
then that would be going
taking-
against,
Yeah,
if
but
we're
what you
bringing in, because Monty might come in and say, I got resources for, we have a whole program for
prenatal.
children with special
For
needs,
prenatal and,
something like that. Like, I think we gotta be mindful about that.
Why don't we do at the Bronx Museum?
It's still under,
It's a
That's
small,
a new-
it's under
it's
construction.
a small space,
Yeah.
it's a very small
what,
space.
on 167th and the
Oh,
campus?
Yeah, it's being remodeled.
It
It's
is?
like,
Yeah, what about the
Oh.
new New York City, Susan, what about the new OMH space? It's 17,000 square feet, lots of
Where is
rooms.
oh,
it?
that's the,
That's the one by Waters Place. It
that's
does not
what it
really-
does, it takes us out the
Too far,
district.
Yeah.
yeah.
Yeah, I think
Another
district.
thing is, Mitch Katz, the CEO of all of New York City Health and Hospitals, has a beautiful TED Talk. He speaks all the time about health disparities and how the healthcare system needs to
Oh,
change.
cats, yeah.
Yeah, I mean, he
What-
could be an option.
Because he is the chief of hospital. So I think, go ahead.
Sorry.
No, what I was just
speaking
saying
his
is that we seem to be going back and forth, rotating like this. I think we should concentrate on a topic that will touch the community right away. I don't want to, let's don't do literature where people just come and sit, don't know what's going on. Let's bring issue that we are living right now to the community.
Yep.
That's the way I think.
So
One of
the
key-
topics.
right.
What are the-
And the
Yeah.
key thing is that sharing information. This is where she's running problem that is available, subject that available, we don't have in our community.
Yeah.
And why do we not have it in the community? These are issues we need to bring somebody from Department of Health. They can answer those questions to us why information are not being disseminated. We have a high blood pressure issue in the community. And a dietitian, we need to have a dietitian to show us how to eat, what we're supposed to eat. And these are things to the average person in the community.
Mhm.
And then we can have two of these. We don't have to have
It
only
doesn't
one
have
or
to be
so
one
something.
big night. You're right.
Why don't we break it down into at least two events?
Series.
Yeah.
A series of program, one every month,
Right.
something like that. I don't see that to be something that will never be
Or every
enough.
3 months, like.
It make no sense doing something not doing it. Let's bring in every other month we do something. And when it comes to Lincoln Hospital here, for instance, they have a staff in place already. This is a full institution.
Yeah.
We can turn to them. They can bring expert to
Yeah.
to our issue.
I think
One of the
Let's create a
goals,
good
I
relationship.
want to add to the Madam Chair,
Yeah.
is that Lincoln, in my understanding, the new CEO has aspirations to growing and rebranding this institution. I think that,
They gotta
what is-
start with that
and-
red
and
rug
this-
that's outside.
So growing the institution in a way that is gonna be an institution, because we understand that this institution has been, like you said, number one for trauma, gunshot stabbings, and and only emergencies. When people want to come to this institution in extreme emergencies, and there has been some horror stories of the institution, and something that she wants to that she's interested, meaning the CEO of Minus wants to turn around. I think so having a healthier conversation about what those goals can be, because it is the public hospital system. It is the
But she's
system
come
that's
from
there's
Metropolitan.
a system that's a
She
bit
left
there's a system
dealing with a whole lot
there's
of
a system that is, well, then that's what the community needs to be able to bring to bear healthier competition, not competition, but conversations that says it's okay to say Lincoln doesn't have that there, and it's offered at this other institution something, and then we need to do better at this. It's healthy to say that we need to say that we need to work on customer service and everything. I'm not looking at spotlighting, but it's about saying where do we need to be, because this is to some people the only health option, unfortunately, that they have available to them. And so it needs to get better. It just cannot go on. So that we talk about setting
Right.
standards,
But
that's
I
a
think-
conversation that
I think there's two different things. I think one thing that you're talking about is like holding the standard. I think that's a
Sure,
conversation
sure.
meeting, right? But then we are trying to educate the community on something.
Exactly.
And it's not on the lack of what
That's
Lincoln is doing or the lack of, but it's more so of these are the issues based on data. These are the health complications in our issue. This is what's so like. Let's have a conversation about that, right? And I think for me, I don't think maybe Lincoln is a place, maybe it's not, right? And I think we really need to think about that. And think about like other options if Lincoln is not the space to do it, because you really want to bring in experts and you don't want to be limited to Lincoln, right?
Mhm.
Because if as someone in the community, if for instance, I don't come to Lincoln Hospital anymore, right? Like I haven't come to Lincoln in a long time. And that's my personal, right? But as people, there's a lot of like, let's be real. People say, I'm not going to Lincoln Hospital.
Yeah, that
I
was
don't
me.
like that hospital.
That was me 40
Right?
years
Like
ago, yeah.
the treatment at that hospital is so like when we're really trying to say like let's raise the bar, we need to really bring in folks who are really doing the work, folks who are like quality, like so if we want to bring in somebody because Columbia Presbyterian is on point,
Mhm.
right? In some areas, if we want to bring somebody from there, then that's who we want to bring because we want people who are doing this work. We want quality folks in front of our community to teach us about what we need to do.
Yep.
And like, if you're a hospital that like I think we need to invite, if we're talking about public health and trauma and gun violence, absolutely we bring in Lincoln Hospital because we know that that's their
Niche.
special sauce.
That's their need.
Right? So we know that's but then if we're talking about like something else like heart, right? We know that like Presbyterian or Bellevue
Yeah.
are like the heart places, right? If we're talking about
Children, then you have
bone
Mercy.
surgery
You
or
have
like
Mercy.
orthopedic, we'll go to the hospital special surgery
Yeah.
or something like that. Like I think we need to really think about what are the issues that we need to talk about. We work from that. Like, all right, what do we want to highlight? What are maybe 2 topics that we want to focus on?
Can I
How
say
about
something?
coastals? Sorry.
Can I say something? Madam Chair?
Our location.
Yeah, I'm sorry, go ahead.
So I like that, but can we find out the do's and the what can we do here in Lincoln
Yeah.
Hospital? Like can we allow these people to come here
Right.
first before we start looking at other
So that we
venues?
don't create feelings.
Yeah.
That's another thing I like to
That's
bring.
true, too.
I like
Write that
to,
down.
for us to be a little conscious about it is
I'm
that
ready.
we are going to sit here and bash this institution. That's our first defense. How many of us go somewhere else? Right?
Yeah.
If we better make it better here,
Mm-hmm.
because
to
the
come
where we
here.
go first, the ambulance pick you up from your home. They wait.
But that's a
where they
different
go.
conversation,
No.
not for the
Let,
symposium.
let me explain myself. What's happening here is that making Lincoln part of the symposium,
Mm-hmm.
give a lesson to Lincoln also to raise the standard, the bar. Because what's happening is just we are bringing experts from somewhere else, bringing Lincoln
Need to
where we
get
think
permission.
Lincoln can fit there. Also, what are we telling our community? Because Lincoln has had a bad reputation in the past. A lot of people today still don't want to come, but we need to bypass that because this is where we go first. I'm serious. Public relation is a key. If we are the one now trying to show the community that Lincoln still don't meet the standard, we have a problem. Lincoln was not a trauma center before.
But I don't think we're trying to make them see that Lincoln doesn't meet the standard. They see that, right? I think the one thing that we want to do is, because I think there's multiple conversations, right? Like I think this conversation about Lincoln raising his standards, that's a real conversation that maybe the CEO just needs to sit with the board and we have that real conversation. Like that's a conversation. Has the CEO sat with the board at all? So that's that's a conversation. If she's interested in like raising the bar and figuring out, then that's real, right? And we also, that's a conversation that we're also going to invite people who actually use this hospital, right? People who we know, like we know one of our board members had their mother here just a couple weeks ago and was horrified by the experience. And so those are the things but that's separate and apart, right? And you're right, you're talking about if we need to identify Lincoln we need to have them step it up. But, and they know, right? Because for years, we know the good hospitals, so to speak. And I think Lincoln also knows where people are going, right? Like it's a thing. But what's happening here is that, again, and this is, it's gonna be political because it's political. What's happening here is that the people in charge of holding city hospitals accountable for how they step up continue to pour in resources and are not holding people accountable. That's the real deal, right? So that's a whole different.
How do we again?
But and I think we need to. That's another.
Let me go back. Let me go back here. If just piggyback on what you just said, somebody was here recently who was not happy. Did they address the issue to the public, to the department? No.
Yes.
No. Have you?
So no. So the person. Let me answer that. I answer it in a way. I think they have to recover from the wounds, so that the conversation could be productive. Yes. No.
Okay. This institution.
He told you about it.
Told me about it.
You're on the council.
Right. But she asked me not yet, that she's not ready to have that, to bring that conversation. Because that horrifying is this a little bit of how she felt.
But that's not it. Go ahead. I'm sorry.
No, the point I'm not trying here to, I'm not trying, I love this institution to improve again. I sat on this board in here for years.
Yes.
And I fought this a lot,
Yes.
And I think we can continue to fight for improvement. There's always room for improvement.
Yeah.
One thing that I noticed is that we do not complain vertically. We go to our neighbor complain. The institution has a department that's sitting there to listen to our problem so they can improve. We don't do it. If you ask anybody here, have you called that particular department? Nobody will call. I came in here one night on the AOD, administration on duty, with a patient, with a friend of mine that was ill. He said, they called her on the phone. He said, tell me on the phone. He's supposed to show up right there when you have a problem. The AOD is a person that's supposed to move around and solve problems at the time.
Yes.
The next thing what I did is I went straight to the administration. I complained about it. Because if we don't know what the expectations are, then you could not judge. You have to know what we're supposed to have to complain that you're not getting it. If you don't know that, we're just gonna run and say, oh, patient experience is something every hospital, somebody don't have good experience. That we can do that, but it's not a general thing. This institution, as far as I know, has made a lot of improvement. It's not enough. We need to give credit where the credit is due. They are doing it, but we just have to keep showing them what they're doing wrong so they can change. This is what all I'm saying, because really I just don't want
the desire to.
They are really willing to work with us to improve, but we need to keep bringing issue to them, not run away with the problem somewhere else and complain. Where you going? Somebody's running away from that hospital too. You know that? where you are going, that is a good hospital, somebody's running from there. Because I sat on with I think with Dr. Cass at one point. There was an issue when I was chair here. We were looking at the statistic of hospital. You know, guess what? We had a chance to see people running from Colombia going to public hospital. So it's kind of perception thing.
Yeah.
The way you express the issue, the way you think you were expecting to be handled. So let's work together and make our community better with the institution that we have. I mean, no, but I'm just saying.
I hear you. No,
okay.
I hear you 100%.
Listen,
I think.
zero.
I mean, listen. This hospital touches a whole bunch of lives, and I think like
Yes.
the urgency is just not. And that's what every city agency, in my opinion. There's a lack of urgency to get where we need to get.
We'll make that.
And so, I think in the meantime, right, while we're trying to get our public systems in order, what's really important is what's happening in the community in terms of health outcomes. And I think like that's what we really want to talk about is like the health outcomes.
Right.
But I also think that we need to set some time with the Health and Human Services Committee to have a CEO. And because how many people use Lincoln who are on the committee?
I'll come to the urgent care. They got
And
the urgent care.
nobody here uses
I got my
Just are people comfortable sharing what hospital they go to?
Oh, of course.
Yes.
I go to Lennox now.
Lennox Hill.
Montefiore.
Sorry.
NYU.
I was gonna say something, but well, I had my son here, and that was over 30 years ago,
They were good for prenatal.
and they were awesome. But then my husband also got shot in front of my building, and they brought him here, and they treated him.
Right.
Oh,
Yeah, they did a great job with him because he was able to walk, and yeah. But yeah, I don't have nothing bad to say about Lincoln. Yeah.
Well, the only time I came here was when I got hit with a car and I broke my leg and my arm. They treated me good. That was 40 years ago.
You don't use this hospital.
Just 40 years.
So I mean, to be honest, like that's another thing. Maybe we survey our community, our district.
Mhm.
How
Yeah,
many
we
people?
should.
Simple question: how many do you use Lincoln Hospital? Maybe for an emergency, for preventative care. Maybe that's something separate that the committee could take on, right? To like service our communities. How many people?
We used to drive people away here was a wait time.
yes.
Yeah.
That's what
Yeah.
It was a wait
Used
time.
to.
That's
Yeah.
still
Yeah.
No, but I've heard,
Está bien.
I've had experiences, I haven't used it
I
personally,
saw a
but
video recently.
my parents, were taken care of here, my father was taken care of here. And I have to admit that the level of care, I was surprised by the level of care that they both received and the attention from the doctors, and the nurses. And I was really surprised about it and that the fact that they have like a different, like triage of the emergency room and how they triage the emergency room made a big difference. But also I just want to point out that during COVID, the height of COVID, my mom was here and the nurses that were here were nurses that were traveling nurses, they weren't regular nurses. And so I don't know if that,
Yeah.
affected, but they were awesome.
That's good. That's good.
So in overall,
So
we
I
see
think
that-
we need to survey. Maybe we start with just board members.
Yeah.
Mm. That's it.
Since the meeting will be with board members, survey the board members to see like what's your experience been with Lincoln Hospital.
we can actually open one in Google.
Yeah.
Where we can actually
yeah.
public is sending our public to our community.
Yeah.
Everyone. Because there's nothing wrong with what we're doing.
Do that.
We need to do that through Google where we send it out, we get the feedback, and then when we get the
And when
feedback,
we meet,
we'll bring the hospital
Right.
administration, we'll
Let's
sit down and say,
survey
this is what we got.
Yeah, like a survey.
have you done? Has Lincoln already done a survey?
Yeah, that is like a community health assessment. Yeah, they're doing like once a year. We have if you would like to see with the surveys.
A community health
Yeah,
assessment?
yes, we have.
Interesting. So I also am the chairperson, which I forget. That's horrible. I was just in a meeting. I'm the co-chair with Dr. Nicola Davis on the health pack, and so
Okay.
we oversee like the systems of the CWHs, which I think that is an amazing program. So I don't know how many people know about the community health workers. Have y'all heard of that?
No.
So there are community health workers in the hospital, right?
Yes, yes, we have like a community health workers. They usually navigate with the patients. For example, like a new patient is coming to the medical pavilion and see the PAC, the general doctor, and they have to fill it out like a survey, like it's just 5 questions. Oh, do you have like money to get food, or do you have a house? And they say no. So the doctor, like what they said, the survey, they send it to the social workers. The social worker they send it to the just to the community health workers. The community health workers they call to the patient, say, okay, thank you for being Lincoln's patient, but you say that you don't have like you're looking for like a housing. How we can help you? So in that case, those
And
like
like that community health worker
Yes.
works with this patient throughout the process to get, which I think that's amazing.
That
right?
is.
I think that's great because our
It's like a
community needs that.
midwife.
That's one of the issues,
yeah,
It's
right?
like a midwife.
They also, in addition to the community health workers, what they do is now in specific NYCHA developments, they have these community health workers working from the community center, from the centers. And so these community health workers work directly with patients who live in NYCHA, who are like elderly. They take them to appointments. They help them get any mobility devices that they need. Like it's a really good program. Like that to me, I think is great, right? When I come into Lincoln Hospital, like, and I'm gonna be straight up, like the things that I look at are like the rug in the front,
Oh.
right? I'm like, it's
Been
filthy.
been there forever.
The bathroom, the walls, the emergency rooms, right? Like where our patients are being held. Like it's just it's terrible, right? Like those are the things like that make me uneasy. Now I'm like, I can't go to Lincoln. I think the worst will happen to me there, right? And so there's a couple of things. But that's just my thing. And then also like the treatment, how you get treated. I remember my grandmother being in this hospital and the treatment was different. And when we took her to Presbyterian, like the nurses it was a whole different ballgame. And I couldn't understand why, right? Maybe Lincoln is overwhelmed, right? Because Lincoln is overwhelmed.
Yeah,
Lincoln has to take
so,
everybody.
like,
And that's
everybody.
another conversation that we have to have
Yes.
around, right, what the public hospitals,
Yeah,
what they do
yeah.
and who they
What's
service,
what
right?
they lacking.
So I think we need to have that conversation. We need to have that survey. We could get real deep on it, but I think like this committee is in a unique position to be the ones to like really, impact and shape what that looks like. But I don't want to I think we got away from like what the symposium.
Well, just if I may say something, what's been coming up a lot is resources that we don't know about.
Right.
Like I've
Right.
already written like 3 or 4 things that I had no idea existed. Perhaps one of the buckets is making this affair, at least the first one, to get people involved. What are the resources that exist right now? Because I'm so touched by what you said, that all of these things exist and there's just so many undocumented immigrants here that could really use that service. And safety nets don't ask questions, right? Like that's part of being the hospitals, the health and hospital system.
Yeah,
And knowing that there are resources that exist, even for those who are documented, but this has been so enlightening. I can imagine, a whole first symposium on resources, like what's out there. So I've just been blown away by everything, all these new acronyms. Like, it's amazing.
So in the symposium, can they discuss about, or would that be in the health fair, about the HIPAA to elaborate more on the patients, what it really is? Because a lot of people just sign
And they don't know,
and they don't know what it is.
Mhm.
So we should like
But I also want to
do a workshop on that.
Yeah. I also feel like what Clarissa was saying in terms of having it into a series would make sense.
Yeah.
Because there's a lot of things that we were pinpointing that is to be the main topic. Yeah. Oh, Amber, sorry. That could be the main topic all the time. But what I agree as well is when we do have the survey out to the board members and also to the community, we need to really figure out what is the priority need within the community. So I'm just like brainstorming.
It's gonna take work.
Yeah.
Like to be honest, to survey the community, it takes work. We had a survey that went out in terms of district needs, and we only got like 60 responses back. And so we have to really be intentional about like how do we survey, where do we go, and maybe it's something that we got to tap into everybody on the board to share. We got 10 leaders, but I think it's important that we walk away with the topics for the symposium, at least for
And get our
today.
politicians involved with that, sharing that news.
On the survey.
Yeah, on the survey with their
survey.
constituents.
Maybe they could share it on their
Yeah,
website.
yeah.
Can we use the student, what they call it, intern,
That too.
to help us on the survey?
Yeah.
What they can do, we could just have a couple of iPads and
Mhm.
have them at the emergency room entrance here.
Maybe we should
Oh,
use the
wow.
GBLU kids,
The
When they come
pediatric.
in, yeah,
right?
when
We
they
have
come
some,
in,
we have summer youth, we have
Yeah, that's fine.
college interns, and I'm
also,
just excited about, what
Getting
I
out
was
in the
working at.
community, yeah.
yeah,
Excited.
because, and we also have to make sure that when we do the random sampling, we have to really make sure we do where is really people that are in the area coming in here. Because when you do a random sampling, you pick a wrong area, you get the wrong result.
Yes.
Yeah, you're right.
Imagine we all live in the same area, we all use different hospitals, somebody come and survey with us, this hospital is zero. But if we in the people that are coming in here,
You could do phone calls.
Mhm.
to
well,
También.
sometimes people get annoying with those phone calls. We can do that too, we can do that too. But I would think that with the youth, with the iPad standing at the entrance here, standing at the emergency room entrance there, 5 days this week, they
Yeah.
can get a good sense of anybody coming in. Let me tell
But
you,
I don't think that's a really good choice, because those are people who are
They're
actually
coming
coming
here.
to the hospital.
well,
We wanna tap into
You
people
risk-
who
you
we
risk
don't know
Valley.
Are coming.
are coming to the hospital, and we wanna catch them. And maybe we start with the nitrogen development.
Yes.
Yeah, and also schools and stuff like that. Yeah, yeah.
Maybe
No,
we
not
start with
school.
nitrogen development.
or do the Google one. Google is kind of easier because through zip code, we target the zip code in this our borough here,
Yeah.
send it out. When you send those out, people.
And tenant leaders have access to their resident information, and they can send it out.
Yeah, there's a night to act.
Yeah, they have an
I
app.
think that would be a good thing to do because again, I don't think that for this committee, I think we need to do this program at least once a month, every other month.
Mhm.
You're not gonna do that one day and come out with it.
No. We've
So-
been, yeah, we've
So
been
let's
meeting.
break it down in a couple of just break it down in like a month and a half, we'll do something.
So-
A month and a half, we'll do
So
something.
my question to you guys is, do you think August would be ideal
For the symposium,
for the symposium?
Sure.
I think August works.
Yeah, so like,
And it doesn't, remember, it don't gotta be big. This is the first one, so we could
Yeah.
start off small and work our way up, and then keep increasing just so that it's manageable and we don't go crazy and then
Have
we
the
lose.
audience.
exactly. I'm going to mention something like that.
Yeah.
You know, community board one always model the signs, Lincoln supporting, vice versa, Lincoln and community board one.
Yeah.
I think should be like taking the lead and in the first time, doing the symposium, because you mentioned these particular symposiums, we are trying to accumulate many topics. At the end, the people is going to be bored and say,
Yep.
I don't know, when they talking about pediatrician, talking about mental health, talking about stroke, talking about hypertension. So we can work in a specific topic. But let's start with Lincoln Hospital because Lincoln, let me tell you, according to the district manager is part of the community. This coming Thursday, we have the community advisory board meeting, and they mentioned community board one is one of our supporters, first supporters. So let's take. That's my advice.
Yeah.
I don't know, no.
That's it.
No, I don't come here
No, it's okay.
unless unless it's like dire, unless the ambulance says,
When
girl,
they
you
bring
got
you,
5
they're gonna
minutes
ask you.
before you're dead.
I
And
agree with
we don't
that.
get you there.
But they say
But
we
it's
do.
been my experience.
No,
right?
absolutely, yeah.
But do you
And-
think
and
your experience can improve?
And also, let me tell you, and
Yeah, okay.
maybe Chairman, you don't.
Absolutely.
Leadership, yeah.
Yeah, and let me inform you something about Lincoln has a strong potential and productive partnership with the Latin American consulates, yes, and with the West African consulates. So now we have an updated partnership how to bring international patients. And so let me tell you, with another city
But
hospital,
that to me is bonkers, right? Because while I get it,
we brought
it's
patients.
great. Let's bring patients.
Yeah.
But we're
Well, they're
overwhelmed
here.
with our
All
own
that
patients.
yeah.
So that is,
To bring in.
that's a struggle.
Yeah.
But I get it.
No,
I
no,
get it.
absolutely.
I think
But-
that
You know,
we
Yeah,
should be
exactly.
concentrating on a
I
project
saw
with
that the
somebody.
leader from
Yeah,
DR, there was the
Council
leader
General.
from, what was his name? He
Council
was
General.
here last week.
The Dominican celebration.
Oh yes, Miguel Velasquez from the Consul General from the Dominican Republic.
Yeah, I didn't know. I was like, well, why? What was the relation to that? Like, what was that? What was his role? Is he a doctor?
No, yeah, he.
Yeah, do
he
you know?
in Dominican Republic he's like he belongs to the police department. Like he's a general. Yeah.
It's like politics. He's a
Yeah.
politician.
No, he's not a politician. No,
So
no.
what is he?
His charge was part of the the police department. Yeah, in Dominican
The police
Republic.
department?
Yes, and Dominican Republic. Yeah,
And there was like this big celebration here.
yeah, because well, then the Dominican
I was
Republic.
trying
That's
to-
a public affairs issue.
The thing is because remember like a Dominican community
Yeah.
is there are like a different communities, a strong they usually there's a networking.
Yeah.
So that's what the reason the flyer they posted the logo from the Dominican Republic is because this health fair is handling the Dominican community.
Oh,
So,
the health.
Yeah.
Ah, okay, got
Yes.
it. That's why I didn't know. I was trying to find the relationship. I was like, I don't get it. But I'm glad you
Yes,
broke
exactly.
that down.
Most of the CBOs they brought those to
Yeah.
participate. So maybe we can do like what I say is let's
Start
take
with
the
Lincoln
Let
Hospital.
us start with Lincoln
Okay.
Hospital. So that's
And
getting you
we'll
a
bring the
different perspective.
experts from Lincoln.
Yes, correct.
Got it.
And now let's
Because
take
we like you. No,
oh, thank you.
I'm kidding. I'm kidding. No, you know what?
So,
Let's make it simple. Let's not complex.
I want to know how the old Lincoln Hospital was.
I feel like a crab now. I'm going back in my shop.
But well,
I'm
I
like,
digress. So what are some topics?
yeah.
What's
And
important?
then also, do you think the time would be ideal? Or do you think we should shorten the time? It's from 9 to 3.
I mean, let's figure out how to plug this in first, and then we figure out the time.
It's not-
What
not-
we need. I tell you, like more than 2 hours is a lot.
There's a lot, yeah.
Right? So I think if you're gonna do something 2 hours, or even an hour and a half,
For the first time.
and then maybe lunch, and then the last one. Maybe we do 2. Maybe there's one early panel, and then lunch, like a networking thing, whatever, and then there's another one. And there's 2 topics. And if we're doing it in August, August is national what? Because there's like a
Every month is like a national something.
The
Yeah.
August also is a month that a lot of doctors on vacation.
That's
It's
right.
a lot of
It's
vacation
like-
in August.
In the last 2 weeks.
Listen, I was brainstorming with Cesar. He was like, "Don't do it at the end of the month. It's his birthday." We were trying.
Because he said a lot of people on vacation in August.
August, okay.
I mean, every doctor can't be on vacation.
That's true.
No, everyone, no.
So you know that Lincoln Hospital is gonna be 50 years next year, March 28th.
The new one.
No, this one. Because the old Lincoln Hospital was on 141st Street in Concord
All
Avenue.
right. So August is recognized for National Breastfeeding Month,
Okay.
Oh, look at that.
psoriasis,
Mm.
children's eye health and safety.
That's it.
That's it.
Yeah.
Oh, and national immunization awareness. So
Hmm.
I mean, measles are important right now.
Yes.
Mm.
Yes.
Maybe they could have.
I don't know if in August. I mean, I'm going to tell you. I had a conversation with the commissioner of the health department, and what she says is that it's really bad.
Mhm.
Measles?
The
Mhm.
outbreaks that are happening in our country
Mhm.
right now, and like in other places too,
Hmm.
it's really bad.
Hmm.
Yeah.
You gotta step up right now.
So was it working with the topic or what?
So the topics that,
I don't know because
These are weak.
let's think about mental health.
August is weak. Maybe everybody is on vacation now.
What's in September?
So some of the topics that came up preliminarily is public health and policy. You okay?
I'm hungry and I'm getting heartburn.
Mental health and well-being, chronic diseases like we talked about, cancer, diabetes, heart disease,
Asthma.
as all those things, obesity, all those
Obesity.
things we talked about. So geriatric healthcare, because we talked about the experience that seniors are getting or who are in critical condition, and then what the experience that our sister felt. So whether or not
Opioid crisis.
so yeah, right.
Mental health is always a big one,
Mhm. That's the top one.
That's the top one.
Heart disease, it's a bunch of stuff.
But I also like the art and wellness.
Mm-hmm.
But that fits into all of these, that's the
Yeah.
beauty, like
Right.
say we said mental health, I mean, one of the main
Right.
things that are happening right now.
Yeah, that's why I was like,
Like,
so
you can
mental
go into-
health, you can put in like
Yeah.
art and
Those-
wellness.
Mhm.
Same thing with public health policy, it's all going into the data being done around the social determinants of health that lead into the arts. Or
Mhm.
maybe
Community-based,
chronic illness.
community-based violence, which includes, like you talked about, gun violence and
You
Knife
can also
slashing.
break it up into like maybe doing August can be women's health, and then in another, like we talk about women's health issues, like whatever pertains, or then in another 3 months we could do men, and then in another 3 months we do children.
so August, September, October, November leads into Thanksgiving, that's hard.
Mm.
Doing it in November.
But not the whole month.
Yeah.
No, the first week, the second week, that's
First
before
week, so
Thanksgiving.
so every 3 months within the first
And we
week.
have Evelyn, who's a doula, that would be really
Yeah,
beautiful.
she can bring her doula too.
You
She
know,
does
that
that.
for the
She's great.
women's,
What is some things? What's a topic that's important? Let's go down and see like what would be one
October
topic
is
that
mental
you,
health.
and maybe we can wean it out that way. One topic.
Autism services.
Yeah, autism is
That's
number
like the
one.
How about for Christine?
for me, it's mental health.
Mental health. Ambrose.
Well, I was thinking about mental health, but she come out with it. I would say.
Chronic illness.
That's okay.
I
You
would
can say the
I-
same.
Yeah, I would say mental health.
Okay.
Yeah.
It's very-
And chronic illness.
How about the DM? What's
What's your top?
what's your top issue?
I like chronic diseases.
As
Pick one
that's,
chronic disease.
yeah, as general.
Every disease.
Cancer.
Is that considered chronic disease?
I mean, it's
Well, it's it's preventive
I
medicine.
feel like
long
is
term.
cancer a chronic disease?
it's something that's coming prevalent.
All right, so we'll put
Yeah,
cancer.
Stage 4 become chronic.
Yeah.
Let's put cancer. How about for you?
I'm between cancer and mental health.
Big one.
Mental health.
Yes, cancer is a chronic disease.
All right.
I'm sorry.
All right. Thank you for looking that up.
Yeah,
You're part of this conversation.
Yeah, yeah, say like cancer or mental
Cancer.
health. But remember, cancer like a big topic. Cancer involves like a prostate, colorectal,
We're
pap smear.
gonna bring it down. We're gonna
We're gonna
bring it
bring it
down.
down.
Which one you say? Cancer or
Yeah.
mental health?
Mental health.
All right. Then
Mental health.
Diabetes.
But you say chocolate?
I have to stay away from chocolate from now on.
So hard.
What you said?
Mental health. I'm with Claudia, the autism.
and mine is menopause.
Oh my God. You know, I was going to say that,
Yeah.
but I don't want that issue to be, even though it's a, nobody.
But I'm gonna put that on the map. But what I will say is mental health has won. So one thing that we can say is that there's a consensus here that the majority thinks we need to talk about mental health. All right. So if we're doing a symposium around mental health, then I think we break it down on like the different things of mental health. Like,
In the family.
The dynamic
Sometimes
of
you
the
have a
family.
brother or sister that's really mentally ill, but you don't know.
Mhm.
Yeah,
Or
that's,
sometimes yourself, you ill, but
Or
you
it's
don't
not
know.
accepted
so
to get
I
help.
think now it's like, well, how do we want to design this around mental health? Right? It's like you bring in mental health experts. I
Yes.
know Lincoln Hospital has they have to have amazing.
Well,
You
yes,
got, like,
absolutely.
They have a whole
That
bunch
is
of
our
soap if they're available because
speciality.
they are, but you can't even get an appointment. I tried.
That's gonna we're gonna put that
That's
issue
a-
over here in this other meeting that we're gonna have.
Yeah.
Can't get an appointment. Okay, we got it.
Well, we're gonna
Yeah.
break mental health into every, I mean, we need to know everything that is.
So we want to know like who is the head of the mental health department.
She was just here
Last week.
last week
Last
about the Lincoln Hospital
Recovery Center. Yeah. That she, yeah.
Oh,
We're gonna move
who's
from
that,
the Segundo Reserve to here. In April, we're gonna move. Yeah, gonna stay in the 6th floor.
Did we give a lot of support?
That's another side.
Yeah.
Yes.
Oh, so that's perfect. He's gonna be here.
That's overwhelmed Lincoln even more. Okay, bring it.
Yeah.
Yeah, so you signed the one about the open streets and the one for, yeah. you signed both
Um,
How about like resources under mental health?
okay,
Types
so
of mental health.
That-
That's what it is. Because the problem is like we have a few, we don't have a lot, but we don't know about it. It's not being like informed, it's not being
So marketing,
out there,
so marketing,
like,
marketing and services.
yeah, like it's not, probably like like you don't see a lot of resources out here, right? No. I found out about ABA because somebody like it's part of Fat Joe, I guess he has like a program and it was under
I think he
his
has a
up page
child
and
that
they
has it.
tagged him and I was like, and it's right here on 149th Street.
What you call it? ADA?
ABA.
And what's the
I think so. ABA is a very like every kid that's on the spectrum is very important therapy. They teach them how to tie their shoes. They'll teach them dress. They'll teach them how to interact with other kids. If you need feeding therapy, they help you with that. Behavior therapy is like all different kinds. So it's like ABA is just all the therapy.
I think we could also make, like, when we talk about mental health, it's like, well, what is the issue with mental health? Is it that our community is not tapping into the resources because the resources exist? Is it that we need to figure out what is causing or how to debunk the stigma?
Mm-hmm.
Like, is that what we want to do? Let's kill the stigma and maybe we name that symposium something of like, the stigma is killing us or something like that. Like mental health is important. So like, and then have like mental health providers who can talk about like this stigma and why it's important for us to break away from that. Cause I talk to young people, the city there's resources. They have like a whole team. You could call this number for teenagers, but teenagers are like, I'm not using that.
Mm-hmm.
So like,
It's a stigma.
there's this stigma
There's a
behind
reason.
it, and it's like, well, how do we debunk the stigma, and also like, how do we make sure that
Young people are not using alcohol and other drugs to help to take care of the mental health illness.
Self-medicating.
Self-medicating the issue.
and we the other part is that we need to bring in like our friends, our families, our relatives in our community
We're getting help.
who don't, and we're like, look, I know that because I have these conversations with my friends and my neighbors, and I'm always like, I'm in therapy. I've been in therapy since the pandemic, and that's like the best thing that I've ever done. But like my family and folks are like, nah. And like you gotta have a bit and be like, look, I know you don't want to do this, but I want you to come with me to this symposium, and like this needs to be some kind of like life changing. Like what we want to do is make sure that at the end of this symposium, people are like registering to sign up for the resources that exist at Lincoln.
Yes, correct.
Like that is the action. Like we're just not doing this to just do it and say community board is doing this, but we're doing it because we want y'all to sign up and get the services. Yes, we know it's Lincoln Hospital. I know, but come, I promise, because he said that this, and she said that they've been good. So, and Ambrose is a big advocate, and he's gonna hold them to the standard. So I'm gonna bring my people, and then we're gonna get them signed up, and they're gonna get there.
So you see that. So Lincoln will host it.
But Lincoln also
we'll do several different ones over. But committed to do like at least 6 throughout their next whatever period of time. Every bi-monthly symposiums on various issues.
And the benefit to that is Community Board 1 is bringing in the people.
And so the hospital has to do their part by increasing standards that the community board highlights in another space saying
We
to
bring
do that.
in 15 people because we're starting off small. Just we want to bring in 100. But if we bring in 50, can they have a priority in getting an appointment for mental health?
So that's what we did last Saturday.
You know what I mean?
Of course, yeah.
That's what we did last Saturday.
Yeah.
The people are requesting like for primary doctor. So we brought like they were like 3 or 4 receptionists, clerks, just registering new patients. Just they were in the main entrance. We can do that, like registering new patients.
That's just the health fair. I mean, the job fair.
The job fair.
The job fair gave appointments out to
Yes,
people.
correct. Just for new appointments. So that is we can do just for for psychiatric.
You see? Yeah.
Yeah.
So I think that would be
Yeah.
something good. It's small. It's
Mhm,
attainable, right? Like,
Correct.
we get some people in, and guess what? The first 10 who sign up today, will have an appointment ready to go.
Mm.
You don't even have to wait.
Yeah, they can do it. Usually they save like a road and just for that particular day. Yeah.
But because that's the urgency.
So
though,
that leads
we
us to the two ideas that we have. So the House Symposium was education, networking, communicate, and peace. And the health fair was going to feed into what you were talking about, where it was talking about the multitude of programs and resources that the hospital has for people coming here to get those immediate appointments. That was the two.
But a health fair is more like you go and you see like, all right, urban health is here, Lincoln Metropolitan.
exactly.
You get a health care screening.
freebie.
What we want is action.
Mhm.
So like if we're doing conference or symposium, however you want to name it, there's got to be something tied to what's in it for me.
Outcome.
Yeah.
I'm going, but what's in it
There
for
has to
me?
be a
And
follow-up.
that's how we need to think. When we want people to come to something, we have to think about, well, what's in it for them?
Yeah, something.
You know,
That's why we have to pick a topic that everyone
that
coming
everyone
there.
wants. And the
will
fact
feel.
that everybody in this room said majority, we had
Mental health.
1, 2, 3. Yeah, majority was mental health. Then that says something. And we know like people are anxious. We're living in an anxious society.
And that's like a key, that it would be great to have not just the major mental illness, but
This car broke down.
anxiety, loneliness are all mental illness, and I think if more people recognize, oh,
Especially our seniors.
yeah, then they can engage, it's not that I'm gonna be put away.
Maybe we can have
We don't have money.
CHWs
Yeah.
at the event.
Yeah.
To say, oh, we'll sign you up.
When the bill comes in,
Picture or anything?
I'll take it. Don't worry about it.
when the bill comes in.
I just. Yes. Let's share cookies now. But for the sake of time, because I know that so I was rambling and talking, but I think definitely have to have action. You know, like what are we doing? And like bringing people. Yes, thank you. Not that I was awful.
It's coming around again. But I really like the idea to sign up right then and there, because I think people will listen because they, but the idea, but okay, well, we're signing up for the therapist. You know, like the therapist, it's one time you try it, but at least you get, people can experience that it's not this
Right.
very
you.
scary, horrifying thing, or you're not committed as soon as you go and you talk to someone.
And also people don't really know what mental health is. You know, during COVID, you know, especially in the spike of COVID, you know, my son transitioned from pre-K into online, and he was a baby. And so what I noticed was like the high level of anxiety. And a lot of people think that anxiety is not part of mental health, or you know, and or if you're you know about to give a speech and your hands is clammy and you start seeing dots and you're about to pass out, no one knows if that's your thing. So I think spreading the word out and just it goes back to the survey. Just trying to see what we can be able to better educate the community and how we can be able to have experts you know, provide some type of information in regards to mental health. So I think that, are we good with this topic?
I mean, for the first one,
For the first.
multiple.
Yeah, we'll have more.
Can you rank them about? So mental health
We
is
have
first.
mental health, we have autism, cancer, diabetes, menopause.
So how many times was who's second after mental health?
Nothing is everything was one.
Everything is one, but mental health was primary.
Autism came up first, and then mental health, then cancer, diabetes, menopause. But that's just the order of the way
Yeah,
you receive.
Sure.
It doesn't mean that the next one
Can spin off to be whatever.
Yeah.
And then the survey is out at the same time, so the survey may identify more stuff or something else that So we run. How long do we want to run this survey when the survey is created?
I don't think the survey has anything to do with
But that, you know,
But you want to see if people come to the hospital? Yes. If they come,
That's
they come for.
yeah,
That's for the
So
conversation.
that's for the conversation with the CEO.
the CEO, yeah.
Okay.
So do we table the health fair discussion, or do we still?
Let's see. If people want to talk about also doing.
So the focus for the health fair was also to, I guess, better educate the community what, you know,
Resources
Lincoln, what resources Lincoln Hospital has to offer. And hopefully try to have like a, So the idea was to have it here. And
It could be a dual thing though. Can you have the health fair and have the
'Cause they
symposium? They could table while it's happening.
yeah, I initially thought that might be a possibility. I wasn't too sure.
Do you guys use the courtyard at all for like events like this?
Yes,
Yeah.
we
I always
had
see the
the,
tables.
we had
Yeah,
the,
tables.
we had the Bronx
Like
LGBT
the
health fair
courtyard
here, out in the
downstairs,
court, in
inside
the court.
The courtyard is in the bigger courtyard.
Yeah, we had
Yeah,
a fair
yeah,
there.
big-
Yes.
I didn't.
I mean, I don't know, under the new leadership, they may
Oh,
change.
that's true, that's
Yeah.
true, that's true, that's
So
true.
That's
I didn't want us to have the
You took
symposium.
We're talking about, the courtyard that's outside the.
Nah,
under
Outside the
the-
courtyard.
I told you.
Yes.
That's why I have them out there.
Yes, we can use that. That's
I- I
really
knew.
nice in the. that's
So
really
you think,
something.
you think of all the services that Lincoln has, we have
That's
all
good,
the,
yeah, we
we
have
have
experience
bigger
with
space.
But I prefer like they can change instead like the 8 August or see like a bit not going to like Saturday. Saturday you can access to all conference rooms, but during the week like they say
Alright.
August
I think a
14th,
Saturday would be good to do this.
it should be
Yes.
Saturday, not
Yeah.
during the week.
Not during the
Yeah.
week, yeah, because a lot of people work.
Yeah,
Usually
Saturday would be good.
Saturday would be good.
And we all hands on,
Yeah.
we don't have
If
commitments.
it's not decided, let's have it.
I mean, I didn't
Outside.
think. I mean, that would be a good idea. So
Yeah.
the focus too
So
was.
Saturday is.
So I thought that if we do the symposium, right, and then depending on the time frame, we can be able to invite the community with all the resources that we have outside, what type of services that Lincoln is offering, and then some.
So when we did the symposium, we had a symposium for the Bronx LGBT health fair here. We did the courtyard and then we had the panel speakers in the auditorium.
Yeah, because the parent will come in with the kids.
So the first and second Saturday, well, the
Yeah.
first Saturday in August is the second. The second Saturday is the 9th, and the third Saturday is the 16th, because there's 1, 2, 3, 4, 5 Saturdays
In August.
in August.
What do you guys think?
Yes.
Second
So-
Saturday.
So
first
second Saturday, second Saturday, and
sounds-
third Saturday?
One of the first, one of the first.
August is so far out that I'm like, whatever Saturday you wanna go.
The 9th and the
But we
16th?
we're trying to brainstorm. We're trying to
As we get close to the end of August, there's a lot of activity going on.
That's what, and then that's the vacation time.
So the beginning of
There's a lot
August.
of back to school events.
Yes.
Beginning of
Yeah,
August.
Right.
then.
Yeah.
That's
Let me, and also charter school starts. So,
Yes.
you know,
Yes, 'cause that's like-
I'm an AI, which is terrible, but let me just say, like, I put this into AI, right? And like, just breaking it down, I just wanna put this out there. Something, it talks about having a keynote speaker, like a mental health advocate, community leader, or public official, kind of open. Having somebody to talk about a personal testimony through their lived experience with mental health or, therapy or whatever. And then it goes into like a panel discussion, mental health in our communities. That's a topic. The truth about mental health, myths, barriers, and solutions.
Mm,
So that's good, right? Because that's what we want to talk about.
yep.
And then the speakers for that can be therapists, social workers, community leaders, individuals with lived experiences. So that's also something that we need to start thinking about. Like, who can we go to? Who's doing this work? Who's a good speaker? Who are some therapists?
Yeah, survivors, yeah.
And then during lunch, we do a lunch and a resource fair. So while everybody's eating, then they go out, they look at the resources. And, AI is amazing, y'all. If y'all don't know about ChatGPT, get it. And then you do breakout sessions, right? It says you have one breakout session, which we can use these rooms, mental health in the workplace, youth and mental health, trauma and healing in communities of color. So that's one. And then you do a fireside chat where I'm assuming we all come back together in the auditorium and we could just talk about mental health and the priorities, the policies in place and the practice. So maybe for the policies, we bring in an elected official to talk about like what policies are y'all putting in place
The chairs of
to
the
make.
city council and state assembly and what the committees to say, what are y'all doing?
Yeah, perfect.
Yeah. And then we close out with a closing keynote, inspiring change. So a speaker, a well-known advocate, therapist, community leader, and then there's a call to action encouraging attendees to continue the conversation. But our call to action is going to be sign up.
Let's share a today.
If we can sign up, if we can sign up 3 people, that's a win.
Yeah.
To start.
Like, and if you sign up 1 person, it's a win.
That's a one, yeah.
Because that's somebody who came in with the mentality of like, I never had therapy, or I don't really believe in therapy.
Mhm.
But if they signed up, then it's like, all right, that's a win. But that was just so that, we kind of like have an idea of like how we can break it up. That's just an option.
Mhm.
I'm aware of Lincoln's, and maybe again, I'm sorry, you the expert. I'm aware of Lincoln's inpatient. What is Lincoln outpatient psychiatric like? Is it like they have here? It's happening here in the campus. They have caseworkers, psychiatrists here.
well,
Things here.
Now, what I mentioned from Segundo Ruiz Belvis, the recovery centers is going to be located here. And also they
That's
have like,
that's the substance abuse part. But what about this trauma? Or
Oh,
what
yeah,
the
they do.
stuff that's happening here besides inpatient, outpatient?
outpatient, they do counseling, yes.
What floor is that on?
That is 6th or 7th floor, yeah, they get located, yeah. It is
Yeah.
You don't want to
psychiatric
do this,
Psychiatric department.
yeah. Use my
But the-
bad.
You know what they
Let
do?
me.
When the schools, because again I experienced it, when the schools call EMS on the kids for like behavior, whatever, and they bring them to Lincoln, Lincoln has like a social worker on site. They have like do the whole evaluation while you wait in the emergency room.
Either they bring them here or they bring it to
That's
water.
what pediatrics, right?
Mm-hmm.
For
For
the
pediatrics, so they go to Toronto a couple of times, but they like right in here, and then you just gotta wait forever for an appointment if they have one. But they give you your services there. They won't release you till you get evaluated by either the social worker or the psychiatrist. From here.
Wow.
When you say forever, you say what? Average 3 months, 4 months? Like,
No, it's 5 to 6 months now.
Wow.
Mm,
Since COVID,
recently.
it's
a long
it's a way. It's bad.
so that's what.
Yeah, you're
so
going
other
through it
places
too,
are
right?
important. Like, what's the one that we just saw recently that that came in to see the visiting nurse service one that was one of the biggest things we're talking about is making sure that their wait time was not more than 2 weeks. Danny had the problem. He said because it's hard to get a kid and a mental health and to see a therapist. So waiting is the hardest thing because the person's like, you know what, I'm not interested anymore.
Mm-hmm.
That's huge.
And, you know, to jump on what you just said, to piggyback on that, it would, I don't know if this is possible, but it'd be very interesting to have the youth committee join us because, you know, Nos Canamos just did a beautiful, much along the lines that you're talking about environmental justice with the youth, and they ran it, they ran breakout rooms, and, you know, also I think it would be great for younger people and teens and adolescents to know they can get help too.
Yeah.
You know, and the groups that have come to see us, like Athena, that group that came and spoke to us, you know, now I've changed my therapy to be with them, and they saw me very quickly. Like you go, you didn't have they take, it's, you know, Medicaid, Medicare, and, but that's all they take is Medicaid, Medicare, no private insurance, but within 2 weeks I had an appointment. So there are resources like that, but it'd be great to get, I don't know if the youth team would wanna get involved with us, because they're so good, especially the Nos Canamos youth.
I will also say that like usually when people sign up for therapy, they're in crisis mode.
Yeah.
Like that's when like in our community, people who are like they sign up, they are like at their peak. Like I'm at my point right now. Like I'm at a point of place. A lot of the time they're in crisis mode. So like the struggle will be is like how do you get someone who feels that they are good? I'm good. Because when they're in crisis mode, they want to sign up. But once they go through that crisis, they feel like that crisis is like gone. That's it. They're like, nah, I'm good.
But that's
So
why like anxiety and stress and loneliness, they can feel that every day.
Yeah.
And if that can be shown as something they need help for,
Right.
not just crisis, these lead to crises
right.
and
right.
chronic illness, but I think it's a good point, like, oh wow, I deal with that every day. I didn't realize
Yeah.
that was an issue. Well, I could get help for that.
I think one of our segments should be tailored to seniors, right?
Yes.
You know,
So that
because
loneliness, that anxiety, depression, a lot of them are home by
Depression.
themselves. I know my grandmother, when she was in the hospital, like they would talk to her about like getting services and like, because she was anxious too, especially like during like the years where they're declining and they know it, right?
Loss of independence.
Yeah, there's a
That's
lot
a
of
big
that.
deal.
There's a lot of that. So our elderly need to know, like, and they're like, my grandma was like, I'm not going to therapy. I'm not crazy. And that's the unfortunate part of like our culture, right? Like, I'm not, that's for crazy people. I don't need to go to therapy. I'm fine.
I'm
And
not
it's like,
seeing
yeah,
Chase you around with a
yeah.
butcher knife. That was my grandmother. Here, Lincoln Hospital.
Yeah.
Next topic.
Yeah.
Well,
Thank you, Chair.
thank you
Thank you,
so
Chair.
much.
Thank
Yeah, thank you.
I
Thank you. This was a
No,
great
thank you. This
It was a
is-
lot.
I mean, it is.
We have a lot-
It
we have-
is.
So we still got some stuff.
So
Yeah, we have a lot.
what we're doing in part of the office team is that we're creating a living document. What does that mean? That,
Yeah.
that we're taking all the information
So
that
everything
pertains
we
to
spoke
special
about
events.
is here.
It's gonna be on a drive that can be regularly updated as we continue to move forward, what we discuss, and where we're going, and so until this issue becomes, until this event gets more and more planned out, the document will.
So putting it on
So
a
we just did the
Saturday.
foundation right
Yeah,
now.
yeah. Right
Yes.
now, you guys gave me the biggest
foundation.
recommendation is to do it on a Saturday and also possibly doing the whole symposium with the health fair.
Mhm.
That's the idea.
Yeah.
And we need to think about translation services.
Yeah.
Oh, yeah.
Yep. That's huge. That's
Not
very
just
big.
Spanish, like maybe even other translations.
Yeah.
Like,
French,
French, yeah.
French, yeah.
Yep.
Cause a lot of things they just do Spanish and I be feeling
And
bad,
Bangladesh,
you know,
like Mohammed.
Yeah,
Like Mohammed
Bangladesh.
had.
Yes,
Yeah.
yes.
Yeah.
Because
Parlez-vous français?
I knew it.
that's the only word I know.
Because I don't want to work. I want to go around.
Thank you guys so much. It really means a lot to me. Next topic, we're gonna talk about the committee merging with LGBTQIA resources and service committee. Do you wanna speak on it?
You're looking at me.
Because
Fair,
you doing
like-
this.
So
Okay.
I'm gonna jump into this. So, we gotta strengthen the LGBTQIA. I think we had a conversation, Audrey and I today, about this. And this committee is one that we started, and it's the only community board in the Bronx that has a space that's LGBTQ. We gotta do more. And so Audrey's gonna be tasked this next upcoming month with sparking, right, Audrey?
Not sparking, but.
That one, I missed that one.
I said not sparking, because maybe the kids call it sparking.
Yeah,
Yeah, they call that.
It's a joke.
Is
It's a
that
slang.
that's what kids used to say?
Yeah.
Sparking?
Sparking.
Or was that like our generation?
No, they saying that now.
No, that's now.
Yeah.
Yeah.
I mean.
Also, I'm saying trending words. I'm saying it in the wrong. So now, so she's gonna get it going. She's gonna get it going. And but like I think one of the things we're merging LGBTQ and health together, right? More than ever right now, the LGBTQ community is under attack, and is under attack by the current administration in the White House, right? And we see that just seems to be the road that they're going, right? The distraction is that, and it's the go-to.
It's causing a lot of anxiety
It's
now in the
causing a lot.
community.
And so I think what we need to do, and this is what, just discussing this, is thinking about what the LGBTQ community needs right now and what we can do for them, right? There are community-based organizations, Destination Tomorrow, that does the work in the community. There are the task force that does work. And so
And
what's
SAGE.
important right now, there's SAGE. What's important is bringing resources, at least having one presenter for the LGBTQ committee. So next month, we'll figure this out, but also inviting community members who are from the LGBTQ committee to be involved, right? So one thing that I recommend is like, if you have neighbors or friends, to let them know, listen, we have, an LGBTQ committee at the community board.
Safe space.
There's resources, but we also want the community's input on the ideas of what the community needs in terms of the LGBTQ space, right? Like for me, and why this was important in creating is because as someone who was part of the LGBTQ community growing up in public housing, there was never a safe space in public housing growing up for LGBTQ youth. And so for me, it's really important to think about like our young people and how they're living through life and going and not really having the safe spaces to navigate, right? We don't know what they're dealing with at home. We don't know, if the family's abandoning them. Like there's a lot. They need healthcare, they need housing. And I also know that Lincoln Hospital have a department specifically servicing LGBTQ youth. So that is something that maybe Audrey has to do the outreach to bring those folks in. right? So that's something that, you know, we gotta.
So let me know, so put you in contact with that department.
Yeah,
Yeah.
you know,
Yeah,
because
yeah.
they need to be at the table.
Yeah, as soon as we finish here, you're gonna give me that contact.
Yes.
But I think, you know, right now it's a very important time to have this committee activated, and it has to be like, it's really important. And the person leading it has to be dedicated to really like leading it and bringing it
To life.
to the community and to life. Yeah. But I think it has a lot of potential. You don't have to be, you can be an ally. You don't have to be someone of the LGBT community. You can just be someone who is an ally, someone who really believes that, you know,
That's important.
they just need services. People just need services, you know?
Can I make a suggestion?
Yeah.
I don't know if they're out of our district, but the Bronx I sit on the board of the Bronx Academy of Arts and Dance, and their focus is the LGBTQI community. And it's for everyone. Everybody can go to bad. Their acronym is BAD. They go
Oh, I
bad.
know. They're my neighbor. They're my neighbor.
Oh, so you know BAD?
Yeah, Arthur's my neighbor.
Oh, yeah, icon of dance. So I think they could also help you though because of their extensive, 25 years this year, network, email lists, and also that they do a lot of health-related safe space work, whether it be mental safe space, physical, safe spaces, and they could really help. I don't know if that they'll have everybody in our, for CB1 area, but
No, they're in Westchester Square.
but they might know.
Oh yeah, they know a few people
And I
here.
feel like, and as you know, and I would love to help you as a board member, anybody. I know that I can connect you to through them, but Arthur. I mean, that's the key.
Yeah, I'm gonna
But
talk
he
to
would
him
be-
and Charles.
be great. And is Callan Lord? That's not us, right? That's
Yeah,
not
Lord, that's not us.
That's not us, right? That's outside. So, but I'm happy to help and send any ideas. I was just trying to look
I
up
don't think so, because I
first.
think, the only one we have in ours is, Destination Tomorrow. But they come out, because I've seen them in our district.
Yeah, because I know them they're by Washington.
Yeah.
But
And we need to tap into all those organizations and invite them. But we were here before, right? I think, but now more than ever, Audrey will need support on doing this. We'll see. And I think you had something to say about Destination Tomorrow.
Right.
All right, so pretty much was to brainstorm what next month would look like, and given the fact that we are merging, I think it's an important message to invite the community in regards to what's going on with the administration, and also everybody feeling anxious and depressed and overwhelmed with the LGBTQ community. I thought that it would be best to invite Destination Tomorrow for a booth meeting so that they can actually, educate the community and see how we can start from there.
Well, we tried connecting Destination Tomorrow with our committee, and we had the co-chair mentioned in the committee and just never panned out.
Okay.
Yeah, I don't think he confirmed, right?
Right, and so we likely try to work on sending an invitation out if there's no objections to an April presentation.
And then eventually the goal is because there's a lot of with health crisis and just people just feeling overwhelmed and anxious. The goal is to eventually separate the community in the future. But I'm here to help, and we're here to we're here.
Build it,
We're here to build it, and just so that Audrey could hold it down for the future.
We'll support it.
Yeah. Any questions, comments, concerns?
Okay.
Other ideas for
If not,
the presentation
For LGBTQ?
or
No, well,
both? For both.
I think, to be honest, I would like to focus on doing something, and I'm assuming, like, for me, there's so many things that right now one of the biggest issues in the LGBTQ community is with trans youth, and a lot of stuff is going on with trans youth, but also there's the trans youth playing in sports that they identify, gender identifying, right? And there has to be some education around that. And it has to be education for our community boards, and others, and for our committee and the larger community board members. And I think that's something that we can do also, is bring in the folks who are doing this work, right? Because right now there's legislation that actually is gone in to protect trans youth, specifically in New York City, through DOE and other organizations. But like, I don't think that our community is like well versed in what's really happening. And I think that is something that we really need to bring to the table. Destination Tomorrow, I think, would be great at doing that and talking about that, specifically because they do a lot of work around trans. But there are a lot of organizations, and I think we just need to tap in and really let folks know that this exists. But it also has to be, again, action related. So like, what exactly are we doing? But that's something that I think the more that people are educated, the more people can make their own choices, decisions, but I think we just need to provide more education around what's happening in the community. So.
Does the Lincoln Hospital section of LGBTQ, do they provide these kind of, because it would be great, especially for the youth trans that are really trying to stay safe, and it would be great if they had someone here. They must.
Also, I also want to say that like, this is also tied into mental health.
Mm-hmm. Yeah.
Yes,
Right?
it is.
So
It
So we
is.
could do that. Yeah.
So we can also add a piece.
That's why I asked to merge with the health and human, so that's why.
But if we can add a piece into the symposium
Yeah, on
about
LGBTQI.
mental health in the LGBTQ community, that might be something too.
Maybe it could be that way, like all the different events. We could have a resource for autism, a resource for anxiety, depression, the LGBT, like that.
Stress and anxiety.
Mm-hmm.
But I think it could be its own whole talk.
Mm-hmm.
So the first one is gonna be the mental health.
That's
Yeah,
understanding.
Yeah,
Yeah.
first
Yeah.
symposium.
First, and then as we're going along, we're gonna give you guys the feedback and updates on what's, how the
How's
company,
it looking? How's
how
it
they're
going?
looking.
And I think there should be like standing meetings set
Yeah,
to
so
focus on that.
each of the committees chair, RG started off that at the end of the meeting, as part of old business, there's a planning conversation about the major events. So this event, they're gonna discuss where we are, updates, get more back and forth, and as old business. It's like youth education. They do the presentations, and at the end of their of the business taking care of any voting items or whatever, they take care of the special event at the end of or towards the end.
Oh, so we have to
And the
be
meeting.
mindful of time. Then.
Yeah, right.
Because it's almost 8 o'clock.
that's
I
old
know
business.
nobody wants to talk about old business.
Yes.
But old business will be now the health fair and health symposium.
Yeah, they would like to mention this to manager. Just we had to secure the date just for August 14th,
Yep.
the symposium. Don't forget to call to Rita tomorrow, Rita, to secure the date.
Yes.
Like that. Yeah,
Read it
because
and then administration to make
Yeah.
sure that.
exactly
Exactly.
today at the auditorium, right? Or
Yes.
maybe just in the conference rooms.
Yes.
Good.
Thank you. So because the conference rooms are not usually used, or the auditorium are not usually used on Saturdays, but just in case, because the summertime, I'm sure they're going to be using the space.
Yeah, the patio, they can use the patio, or the gray lawn, they can use.
Gray lawn is beautiful.
Yeah.
I would have thought that if we can do that
Now
on one
that's
side, that would be
Yeah.
fine. We should try to have, for instance, like a help first to sponsor. They will be able to bring the jumping jack for the kids out there, make it a family event. Because what happens is that when you make it on a weekend, on the summertime, the parent would come in when the kids are playing out there. Also, we'll be having some educational thing in the lawn out there. I think that will, and I'm sure Metro Plus will be happy to sponsor that event where they can bring all those in at no cost to us.
Yeah, we have like a HMOs. We can work with Metro Plus, Health First,
Yeah,
United
one of
Healthcare.
those, yeah.
Yeah,
And then
we
how-
can-
But you have to put that in early in advance
Oh,
because
yeah.
yes, at least 3 months ahead of time because we are now in April. They're already
Yeah.
planned for the summer.
Yes.
Their summer
plan,
program is already
yeah.
in. But again, that could be squeezed in, depending on how you bring that subject in. But
And they have to work with the flyer too.
Yes.
Right.
So
So-
you need a flyer. You
Logo.
get a flyer, you email them and then.
Marketing,
Sponsors.
advertising, marketing.
You can also just have lots of
Yeah, whatever they can, I mean, whatever that can be
You're in
done
charge of
for
art.
the kids,
You
yeah.
better be in charge of the art.
I'm
And
not an
Ambrose
educator,
is
but
calling
I'm
up first tonight, so.
You agree? You're in charge of the art.
That's how that's
Listen, when it comes to health issue, I think I don't play with that. It's-
You've been saying this for a while.
Yeah.
The health resources.
Yeah,
We said this in the beginning.
It's something that
I remember.
without the help, you can't do anything.
Right,
Now,
I
it's-
agree.
You know, it's something that I'm very big into,
Yeah.
this health issue. You gotta make sure that, and plus this city has a lot of resources. And I don't get it how the resources are out there, but some people don't get it. Is it we don't look for it, or we don't have somebody there that's
We
really
don't
willing
look
to
for
share
it.
it with us?
That's
We don't know.
that's
the main one.
Yeah,
We
no,
don't-
no, because educational part of knowledge is a key. We always think that somebody has to give it to you. One of the things that
But that's systemic.
Remember?
The 20
Yeah, but-
years, yes.
That's a
I
systemic
hate
issue.
that. You know why I hate that word systemic?
But it's real.
Now, let's break the word systemic down, right? Systemic is people that create a system, all right? That's working. Now, if you can put the wrench.
Oh, wait, we
Something
having
that's
side
coming.
conversations.
Yeah.
Is this meeting closed? I'm sorry.
She's
No, no.
talking about it.
Yeah.
Sorry.
No.
Let's continue this though.
Yeah, no.
Sorry about that.
So we don't have any old business. No. Anyone wants to discuss anything? No. Motion to adjourn.
We make the motion to adjourn.
Second. Any discussion?
No.
All right. That's it. Thank you
So,
guys.
systemic, right?
Right.
You see,
Good,
we're gonna
good,
come up
good.
with that word
Okay, we
systemic.
gotta-
Oh, yes.